And this is part. So this is a feedback from our Hakka interpretation team, and readers are very grateful for Father Zhen Yangqing for his sharing. So our feedback is saying that we're able to invite them to join us. So I asked our cameraman that no matter how you film me, how you take picture of me, just make sure I look skinnier. So today I would like to introduce you to our next speaker. If we have come upon the situation, make up the professional doctors attend. So when I walk a little faster, I feel very tired. So Ajay is a professional cook because obesity already affects his health. His BMI is 55, according to medical report. Over 55 is serious obesity. Today, Billy will give us go through the medical help. Will help people to get this. So, Dr. tells the meaning of this study group. So everybody was thinking, if you are fat, you need exercise. So I always say, eat today, then exercise tomorrow. So it's very hard to keep a fitted figure. So let's see people seeking the reducing weight. There's a place. This place looks like a 5-star hotel. So this in mid-Taiwan, the doctor is specialized in reducing weight for overweight patients. So it was the best fitness exercise room and a 5-star operation room. So let's maintain our fitness. Don't go into this hospital. So let's meet
Mr. Dr. Li Minxian from Taichung Tzuji Hospital. Hi, Dr. Li. Thanks for introduce for Tzuji sister.
谢美师姐的介绍哈，那刚刚在过程当中，我知道大家就是上了大概半个小时的课，那大家就动一动，我觉得这个
easy
非常好。
mind to think.
那我想呢
Look at this.
今天介绍这个，大家就轻松听一下，就是肥胖它其实呢，并不只是我们的外表。
So let me share with the medical advancement for curing the obesity. Let's look at the movie. About 15 years ago, one morning I felt chest pain through my body, so the doctor advised me to reduce my weight. Now let's replay it.
sorry，因为刚才不小心播放2次，我收掉一个哈。Sorry， 我马上哦。
那边有声音，就直接听他的声音就好，谢谢。
我知道，嘿，所以请再给我一点时
间。
Dr.
Lily will originally plan to go online here. About 15 years ago, one morning, I felt chest pain through my body, so the doctor advised me to reduce my weight, or I will try to install stands every year. The doctor said that he has installed 5 stands. If he does not reduce weight, his life will be threatened. He also has type 2 diabetes with his weight. He has to reduce weight to stay alive. The patient said my blood sugar level is always high. 2.5 years ago, he got the gastric bypass surgery plus exercise. He has reduced weight for 40 kilograms. The doctor said when the surgery is done, the food can flow to the small intestine very fast. This will induce the patient to have the incretin, which energizes the pancreas to create insulin, which will cure diabetes. So I'll see another movie. After the first baby is born, my weight problem is not so serious. But after I have the second baby, my weight just went up too quickly. At that time, I can eat 2 bindam by myself, and I can also eat the leftover food from my children. I was always eating. Then she started to have asthma and had snoring and sleep apnea syndrome. Started seeing doctor 2 years ago. She had laparoscopic sleeve gastrotomy to divide the stomach into 2 parts. Divide the part as the grilling, reduce the distance for mixing the foods, so the calorie absorption will be reduced. The husband said he is happy for his wife. Happy every day, look pretty. I can concentrate on my 2 kids, the mother said. So Superintendent Chen asked Dr. Li to come to Taichung Tzuji Hospital, and the Metabolism and the Weight Reduction Center was opened to the public on 2019, October 8th. So Metabolic and the Weight Reduction Center doing the bariatric surgery, gastric bypass surgery, laparoscopic sleeve gastrotomy, and we have successfully accomplished 3,000 operations. We won the honorable SNQL logo certified metabolism and the weight reduction center. And we also won the Taiwan Metabolism and the Weight Reduction Surgery Medical Association certification for honorable metabolism and the weight reduction operation center certificate. And we also went as SNQ quality certification for high quality standardized laparoscopy weight reduction surgery. And this is me, Xian. And modern society living habits spend very little time on physical exercise when eating a bowl of veggie spicy pork dry noodle in 5 minutes will produce 600 calorie average 120 calorie per minute. Riding bicycle for 1 hour, calorie consumption only 460 calorie per hour, average 8 calorie per minute. There are a lot of places you can get good food. So weight changes becomes the energy imbalance. The goal of every bariatric procedure is to assist in reducing daily calorie intake. The cause of the obesity is as follows based on gene, overtaking of calories, unsatisfied demand, lack of exercise, increased appetite, hormone abnormal, and endocrine disorders. So the effect of overweight, obesity in childhood will be hard to cure when grown up because the fat cell increased. Obesity will harm the balance of bones and will increase the pressure of joints and easier to get arthritis and even sports injuries. Overweight people will easily to get diabetes, heart disease, high blood pressure, snoring, and the sleep apnea syndrome. Gout, kidney disease, asthma, osteoarthritis, varicose veins, high blood fat. That people will always easily come up the following situation: left by relatives or friends, treated as an uncontrollable person, can easily get adult disease. The character can become melancholia. Effect of diet, exercise, and behavior can have effects on our own weight. The comparison of influence on body weight reduction between using medicine or surgical operation. The gastrointestinal tract is a hormone organ. The reason for failing to do weight reduction is because of failing to resist hunger. Ghrelin will cause us have the And that's why the exercise. So another case, Yiling is a girl was saved from her critical condition. Her height is 160 cm, weight is 136.8 kilograms. She has diabetes, shining liver, difficult breathing. Partner, his parents worry about the health condition of the child, so bring her to Haizhong Siji Hospital. During the operation, in the hospital due to lack of oxygen, need to stay in the ICU for 7 days. The medical team took care of the patient for the whole week, and parents see their child from Miaoli County. The condition becomes stable and is discharged from the hospital. Come back, revisit the hospital. She was lost 50 kilograms. Father, they're happy. Another case is weight at 138 kilogram, BMI is 46.4. He is supporting his family due to overweight. He was diagnosed of congestive heart failure. He was advised by his doctor that he needs a change heart surgery, plus high blood pressure, diabetes for many years. After the laparoscopic sleeve gastrectomy, 5 months later, his weight become 87 kilograms, had blood pressure, diabetes reduced. The heart flow of blood condition improved. Original will need change heart just by the 3 small hole surgery. The heart problem also get relief. It's really unbelievable. So what's the bariatric surgery? Weight reduction surgery? Like sleeve gastric surgery, gastric bypass surgery? So we can use this surgery. We can stop the bleeding. There is no harm to the intestine, and we don't have the so you will recover much faster. So Dr. Lee has helped 3,000 patients with 3 small hole when the patient can be discharged from the hospital within 3 days after the operation. So what is laparoscopic sleeve gastrectomy? Using laparoscopy to cut the sleeve part of the stomach, keep 1/3 of the stomach. The volume is about 100 cc to reduce the food amount eaten and reduce the ghrelin to accomplish the goal of reducing weight. This is the organ taken out. What is gastric bypass surgery? Use laparoscopy to separate the stomach into 2 parts. One is a small stomach, the other is the big stomach. The small stomach is 30 cc to limit the food eaten amount and bypass a portion of the small intestine to reduce the effect of calorie assimilation. This is a condition in the operation room. It's become a training center for doctor to do operation. This is one of the operation pictures. Both the laparoscopic sleeve gastrectomy and gastric bypass surgery are approved operation to treat diabetes. Average will reduce 75% of the weight of the overweight amount. So laparoscopy has very little hold after the surgery. The effect will be no nasogastric tube, urinary catheter, and no drainage tube. The medical team with nurse, nutrition, and other doctor, the whole team with the best combination will provide the best service to the patient. And the whole medical team with the integrated team to provide good service environment is arranged for patient. The operation bed can sustain 300 kilogram weight. Very feel comfortable in the patient area, and the related beds are well equipped and can carry the patient using very high-resolution video 4K equipment for the visual of the operation, and we using very high precision equipment for the operation. So one operation takes about over 1 hour. Will accomplish since the beginning of the center open till now. We has accomplished the 1,036 weight reduction operation successfully. Patient less than 1%. Patient can walk out of the hospital, don't need to stay on a wheelchair when discharged from the hospital. And the number of operations in 2023 in Taiwan, all different hospitals doing this kind of weight reduce operation. So the reduction successful rate is very high. So we also accept the operation modification from other failure cases. And we see a lot of accomplished and successful cases on the publication. And you can see all the patients can accomplish weight reducing goal by comparison before and after the operation. We have shared our accomplishment in the Tzu Chi activities, so all the Tzu Chi member knows about that. This is another successful case, personal sharing. So he said when he got in the car before the operation, he usually need to pull the chair all the way back before the surgery because he could not get into his car. After the operation, he lost weight, about 45 kilogram body fat is also reduced to normal, and the BMI goes to normal, and body fat is like excellent. So his goal is over his goal, He uses S-size T-shirt. So, who should do the operation to help to reduce weight? So after 6 months to a year, the weight goes to very normal. Who should BMI is greater than 37.5 is called obesity. And some BMI also have diabetes and chronic disease, high blood pressure, or high blood fat. So all those people will consider to take the operation. This is a picture of Taichung Tzu Hospital. So all the operation patient environment, and we even got health equipment. So anybody have this kind of problem can call us. Thanks for your listening. So Dr. Lee, usually we don't need operation, but if we need it, and Taichung Tzu Hospital provide this.
也知道说最好是不要，但是真的有需要的话，台中慈院其实是有这样很好的一个场域哦。那请我们主任把你的简报收掉好不好？
So let's see the advertisement.
也导播也 take 我画面这个简报，因为它也挺赞的，就是你看。
So we can see a lot of patients who have very heavy weight. After surgery, they can fit to their normal size of the body. We know it's very important to exercise to keep our fitness. So from Wei Hai Wanwei, she has failed the weight reduce failed 3 times. So she will try. So she tried to control weight to exercise at reduce 5 kilograms.
2个月已经减下10斤了，不是10斤不是10公斤哈，大陆10斤，还要好好的努力才是。感恩李主任的分享，让我受益匪浅。10斤已经6公斤了，那很厉害了，王慧，你快穿下旗袍了。但是因为王慧师姐
Son is getting married now. She is in Shandong. It's hard to come to Taichung right now.
也来不及了。加拿大的管心理说，肥胖或许不是绝症，但太过肥胖有时真的会
from Canada,
然而不健康的
when
减重
Xingning replied, they all need to have efficient exercise. So thanks, Dr. Lee is the best represent how to keep our body fit. Thanks, Dr. Lee, to give us good sharing.
非常再次用掌声来感恩我们的主任，谢谢，感恩台中慈院哈，棒棒都是强棒。那现在请回到
okay, when he's not doing the online translation, he gives us a lot of feedbacks.